Before we get started with the show, I want to throw some love to my listening audience in the following countries. United States, I see you have my back. Hello, Australia. I see that you're coming through for me. Oh, and my neighbor, Canada. The quickest way that I can get to you is through the tunnel or over the bridge. Norway, I see you. Hello, United Kingdom. Tell Prince Harry and Prince William that Susan says hello. Brazil, Sweden, Kenya, how are you today? Maldives, Germany, Mexico, I love it there. Indonesia, Ireland, Belgium, South Africa, Croatia, Hong Kong, hello, Japan, Czechia, Poland, Turkey, hello, Iran, Denmark, I see you, Russia, Spain, hello, and India. And to all of those who tune in from Apple Podcasts all the way to Wishka Stations, thank you for tuning in to my story, Living with Lupus. The views and opinions expressed on my story, Living with Lupus podcast, represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My story, Living with Lupus podcast, is officially trademarked, all rights reserved. Welcome to another episode of my story, Living with Lupus. I'm your host, Susan Hendricks, and I'm so glad that you can join me on this Friday. Let me start by saying good morning, good afternoon, or good evening, wherever you are. Got a question for you. Have you heard of temporomandibular joint dysfunction? Or let's see what else pops into my head. Lenten planus. If not, stay tuned and you'll find out. So you know what I want you to do. That's right. What I ask you to do all the time. Come on, grab your cup of coffee, your cup of tea, and if you're listening late at night, you know I appreciate it. So come on and join me right here on my story, Living with Lupus. First-time cruisers, presented by Parisian Park Dreams and Themes. Cruise with a twist, right side of 50, hosting a session, stepping into my newness. Door prizes, raffles, and fun in the sun. April the 2nd through April 6th, 2020, Jacksonville Cruise Port, Jacksonville, Florida. Deposit $150 due July 10th, 2019. Ports of call: Freeport and Nassau. $579 Ocean View per person. $554 interior per person. Contact 770-982-9399 and ask for D. Parks. Entrepreneur and creator of Right Side of 50. And I am my sister's keeper. Sheila Smith, motivational and empowerment speaker, is available for your next empowerment event and conference. You can book her for your next event at rightside50@gmail.com. That's RIGHTSIDEOF50@gmail.com or call 470-330-1426. Each one encourage one. Hey, I just want to say thank you to all my new listeners. Now, let's get started with lupus and oral health. We know that lupus affects all ages, genders, and ethnic backgrounds. But did you know up to 45% of patients with lupus experience mouth sores, one of the most common lupus symptoms? Oral health complications for people who have lupus can include red and white sores, usually painless, on lips, gums, and roof of the mouth, dry mouth, Sjogren's syndrome, thrush, which is yeast infection, cracked lips, periodontal gum disease, and lichen planus. Now you may be saying, what is lichen planus? Or I never heard of that, or the doctor never mentioned that. Well, let me tell you. Lichen planus is a condition that forms a very itchy rash on the skin or in the mouth. The exact cause of lichen planus is unknown. It may be related to an allergic or immune reaction. Risks of the conditions include exposure to certain medication, dyes, and other chemicals, antibiotics, gold, arsenic, iodides, and diseases such as hepatitis C. Lichen planus mostly affects middle-aged adults. It is less common in children. Now, possible oral complications of lupus treatments. Many of the medications prescribed to us to treat the side effects of lupus can cause issues for the mouth and teeth. Steroids are commonly given to lupus patients, but can cause cold sores, thrush, which is a yeast infection, dry mouth, swelling, joint pain in the jaw, TMJ, and even damage to the bones of the mouth and jaw. Now, you may be wondering, what does TMJ stand for? Well, it stands for temporomandibular joint. Now, this temporomandibular joint connects your jaw to the side of your head. When it works well, it enables you to talk, chew, and yawn. For people with TMJ dysfunctions, problems with the joint and muscles around it can cause pain that travels through the face, jaw, or neck, stiff jaw muscles, limited movement or locking of the jaw, painful clicking or popping in the jaw, a change in the way the upper and lower teeth fit together. Jaw pain may go away with little or no treatment. Treatment may include simple things you can do yourself, such as eating soft foods or applying ice packs. It may also include pain medications or devices to insert in your mouth. In very rare cases, surgery might be needed. Patients experiencing dry mouth, especially for extended periods of time, are at an increased risk for cavities and gum disease because saliva plays an important role in fighting these issues. Now, a while back, before I was diagnosed with SLE, I experienced swelling in my jaw, and then what felt like a hard substance attached itself to my jaw. And at the time, I was going to doctors and emergency rooms trying to find out what it was. I was told it could be cancer, and then I was told they didn't know what it was and referred me to a specialist. And come to find out, my submandibular gland, which causes saliva, had become infected due to the lupus symptoms. So I had to have the submandibular gland removed, along with several lymph nodes alongside of my neck. And during this process, at the time of the surgery, of them removing the lymph nodes that were inflamed, they cut my main artery. And so now I have 4 titanium clamps inserted on my main artery in my neck. Now, getting back to the possible oral health complications of lupus treatment. Some drugs intended to weaken the immune system's response, immunosuppressives, can delay healing and increase the likelihood of infection. So it is important that both your physician and dentist are aware of all the medications you are taking and any dental procedures you may need to undergo. These medicines can also increase the risk of oral cancer, so a thorough screening is an important part of each dental exam. Now let me ask you this. When you go see the dentist, do you inform your dentist or your dental hygienist that you have lupus and that before any procedure be done, that you have to have antibiotics? I'm even talking about for even a general cleaning. Have you informed them of that? That is so important, that you let them know that you have lupus. And if you're on any treatment for the lupus, that you receive antibiotics before any treatment. Before I have my teeth cleaned, the dentist gives me antibiotics. If I have to have a tooth extracted, they will give me antibiotics first and then either come and have the teeth cleaning, or if I need an extraction or filling, before I have it done, I will take antibiotics. Want to give a shout out to everyone who participated in the poetry contest with Detroit's own Author Henery X. You are all winners, but he chose several winners, 5 to be exact. And here they are. And go follow them on IG, poetic_serenity, Antonia_writer, Najee_the writer, the_passionate individual, and Right to Inspire _108. Congratulations. And everybody, go follow them along with Detroit's own Author Henery X. He is the author of Positive Energy 24/7 and his latest book, It Was Destined, Urban Legend. He's Detroit's own author, Henry Long. To purchase an autographed copy of his books and to purchase his ebook, go to WritePath247.com. That's WritePath247.com. You can also follow him on Instagram at WritePath247. Excuse me, practicing good oral hygiene is good for everybody, but it is especially important for people with lupus. Every lupus patient should tell their dentist about their condition and arrange for communication with their physician. Inform the dentist of patients' health history and medications and any supplements that you may be taking, as this can impact dental exams, cleanings, and procedures. Lupus patients need to maintain a regular schedule for dental care, and the dentist may recommend more frequent visits. Now, does anyone out there have problems with the toothpaste or mouthwash you use? Well, I do. I used to use Arm & Hammer, and it irritated my mouth really bad. And for a mouthwash, I used to use Listerine without the alcohol. That irritated my mouth really bad. So I had to switch over to a more natural brand of toothpaste and mouthwash. And the toothpaste I use now is called Hello, and the mouthwash is called Hello. It's a combination of coconut oil and charcoal. This has been the only toothpaste and mouthwash that I can use that does not irritate my mouth. And when the other brand that I was using irritated my mouth, I had to use my oral paste that the rheumatologist prescribed because my mouth would break out really bad. But good oral hygiene is a must and is important for individuals with lupus. Now I'm going to give you some tips for oral health. You have to stay hydrated by drinking plenty of fluids. For dry mouth, ask about saliva substitutes. Now, I have one that the doctor rheumatologist prescribed. I think it's Pylorquin or something like that. I don't have the bottle in front of me. But I take one tablet 3 times a day. And it, to me, it activates the saliva glands and produces more saliva to keep my mouth moist due to the Sjogren's, which is basically dry mouth, dry eyes. The dentist may recommend a fluoride rinse as well. Brush at least twice daily with a soft bristled toothbrush. Floss every day. The dentist may recommend following flossing with an antimicrobial mouth to kill bacteria and fungi. Patients may want to avoid foods that are hot, spicy, or acidic to avoid irritating mouth sores. Patients with UV light sensitivity should wear a lip balm with SPF protection. Talk to the dentist about recommendations for your individual diagnosis and come up with a treatment plan just for you. Now, you may have a question. Can a person with lupus go under anesthesia when undergoing a dental treatment? Well, a person with lupus who is undergoing dental treatment usually will be administered local anesthetics, such as lidocaine. The person with lupus may need to be administered antibiotics, as I mentioned before, following a dental treatment to prevent possibility of an infection. Should the person have a compromised immune system, the more serious concerns are the cases with systemic lupus whose circulating blood has been affected, hence their coagulation system. Serious bleeding problems may occur. Consultation with the physician and controlling any bleeding problems before a dental treatment is to be considered. Also, the person with systemic lupus may have their heart and its lining involved, and for this reason, they are more prone to endocarditis, which is a serious infection of the lining of the heart that can be induced with dental treatment. Therefore, the person with lupus needs to be pre-medicated with antibiotics. Now you see why the antibiotics are so important. Now, you may have the question, is there a benefit for a patient with lupus choosing a dentist who has knowledge of lupus and or other autoimmune diseases? Well, a dentist or any clinician treating a patient with lupus has to be aware of the intraoral symptoms of this disease, as at times this disease first manifests itself in the mucosal lining of the mouth. These lesions can at times be treated with topical ointments I just spoke about that contain steroids. Also, the clinician needs to be aware of pre-medicating the patient with antibiotics before commencing treatment. So be sure you inform your dentist. I can't express it any better. It is important that you take antibiotics before any treatment. Now, since I have a blood disorder, a clotting disorder, I have to be really careful. Whenever I go to the dentist, it causes concerns, not only for the dentist, but for all of my physicians. I have to be real careful. Even my sister will take off of work just to watch me after I have a dental procedure. Now, if you suffer from dry mouth due to Sjogren's, I'm going to tell you what you can do. You can chew sugar-free gum, or you can suck on some sugar-free candy, or take sips of water throughout the day. That will help with the dry mouth. Now I remember the medication that the rheumatologist put me on is pilocarpine, and it's not suitable for everyone, but it helps with my dry mouth. It keeps the mouth moist for a couple of hours, so it really helps. But if you have dry mouth, it's important also because you can get infections in your mouth from the dry mouth. It's important that you take the sips of water, or suck on some sugar-free hard candy, or chew on some sugar-free gum. You know, I know quite a few individuals with lupus who have lost some of their teeth, and some who have lost all of their teeth due to this illness. But you know what? These individuals are on state insurance. And when you are on state insurance and you are in need of teeth, and if you have, let me put it this way. Say, for instance, that I lost the majority of my teeth, lower teeth, in the back. And say that I have one tooth extra, and if I was on state insurance, do you know that they would not provide me with a partial? That's right. If you are an adult and you are on a state plan here in Michigan, if you have one tooth extra, they will not give you a partial to help you chew your food so that it can properly digest in your system. And if you have lupus, and we're talking about individuals with lupus, they don't even consider the damage that this disease not only causes to your health, but to your oral health. Now, isn't that crazy? Yes, I know people who have lost the majority of their lower teeth, but they have one tooth where the state will not provide them with a partial. That one extra tooth they have will not provide them with a partial on state insurance. Now, the individuals that I know who have lost all their teeth due to the treatments they receive for their lupus, the state will give them the runaround about providing dentures. That's right. It is the doctor, your rheumatologist has to send in paperwork stating your condition, how severe it is, how it's important for you to properly chew your food, along with the list of your medications. They send that in to the state. Sometimes the state will approve. The majority of the time, the state will deny, especially if you have one tooth extra in your mouth. They state that you can still chew your food properly. Now, can you imagine that? It's not like we caused this illness ourselves. But if you're on state insurance, that's what they will do to you. Now, the next thing is the trouble in finding a dentist that accepts state insurance. And most, or the majority of dentists here in Michigan will not accept state insurance, and that's based on the slow turnaround in payment and the low payment they receive for seeing a patient with state insurance. That's a trip. Now, if a child, say for instance a child has lupus, the dental service for children must be minimally included, which is relief of pain, infection. They get restoration of their teeth, maintenance of dental health. Now, no comprehensive exams. No, because I've heard some stories from people who have state insurance that state that they don't receive comprehensive dental examinations whenever they go into the dentist. And they say, well, what's the point in going to the dentist? I'll just sit up and let the tooth fall out. Or they may think later, after, if they have a cavity or something where the pain really hits them bad, to go on to the dentist and let them give them a filling for that tooth. But the better the insurance, the better the service. The state insurance, you get minimum care, just enough to get you by. That's it. That's just like when it comes to health care. The better the insurance, the greater the service. State insurance, you get the basic care. They're not going to spend the time with you. And that is true facts. So, if you have a state insurance for dental care, you're going to have to do a lot of searching trying to find a dentist. And maybe in your state, it's better than in Michigan. Because in Michigan, you will receive the minimal of care, which is a cleaning, x-ray, and you'll get a filling or an extraction. That's it. And remember, if you have one tooth extra in your mouth, they will not give you a partial. If you have no teeth in your mouth, all of it involves paperwork. And truly, it boils down to money. It boils down to the money. If a dentist is going to make less money on you, let's be for real. What type of care do you think you're going to receive? Minimum care. The basic, just to get you by. But your oral health is just as important as your overall health, because your teeth can cause so many complications to your general well-being. And that's what I'm speaking about here in Michigan. That's what they don't realize. When you're dealing with a chronic illness such as lupus, they don't realize what you go through, the damage that it does. It's just one thing after another. So check your, if you're on state insurance, you're going to have to call your local Department of Social Service and find out what is covered and what is not. And you also have to search for a dentist who will see a patient with lupus that has state insurance. It sounds complicated, but it really isn't. It's just a lot of legwork that you have to do. I know here in Michigan, it used to be a manual that they had that will list all the dentists that would accept state insurance. So check with your local Department of Human Services and find out what is covered under your dental plan, so you won't be surprised when you walk in, when you finally find a dentist that accepts your insurance, when you walk into that office. We'll be right back. If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. adult living in standing room only cells with no room to lie down and concerned about serious health risks. How would you like that? How would you like to be a female drinking from a toilet because you were thirsty? Think about that. You know, poverty is not a phenomenon. The word itself comes from the 12th century, but the modern interpretation is commonly defined by U.S. researchers. The state of living in a family with income below the federally defined poverty line. Absolute poverty is a measure of the minimum requirements necessary to afford the minimal standards of life-sustaining essentials. We're talking about food, clothing, shelter, clean water, sanitation, education, and access to health care. These standards are consistent over time and are the same in different countries. You know, some of us will say poverty is a state of mind. But if you've never lived in poverty, if you've never lacked anything, how can you say it is a phenomenon? Can someone answer that question? You know, it's one thing in life that I learned, and it's this. An individual has not started living until he can rise above the narrow confines of his individualistic concerns to the broader concerns of all humanity. You see, we must all learn to live together as brothers, or we will perish together as fools. Because our involvement in humanity, we must be concerned about every human being. You see, I'm for truth, no matter who tells it. I'm for justice, no matter who it is for or against. I'm a human being first and foremost. And as such, I'm for whoever and whatever benefits humanity as a whole. You see, the sole meaning to me of life is to serve humanity. People, poverty is not a phenomenon that happened 2 years ago. Don't forget, July the 19th, it's Life Lessons with motivational speaker and the creator of Right Side of 50. I'm talking about Sheila Smith. I'm Susan Hendricks, your host, for my story, Living with Lupus. Have a great weekend, and I will see you next Friday for another episode. episode. The views and opinions expressed on my story, Living with Lupus podcast, represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved.
The podcast you just heard was made using Anchor. Ever thought about making your own podcast? Anchor makes it really easy for anyone to get started. It's a one-stop shop for recording, hosting, and distributing podcasts. Best of all, it's 100% free. Sign up now at anchor.fm/new. That's anchor.fm/new to get started.